Now, the world has been grappling with COVID-19 for just over 20 months. In fact, it's nearly 2 years. December is going to mark the first 2 years, second anniversary. Wow, how time flies. When it hit South African shores, the virus seemed not to target specific sectors of society. Since then, South Africa's stark inequalities appear to have left vulnerable communities more at risk. Well, for more on this, I'm joined by Professor Refilwe Nancy Phaswana-Mafuya, Professor of Epidemiology and Public Health at the Johannesburg University. Prof, good afternoon. Thank you very much for your time. And can we start here? I mean, your research, just explain your research to us, for our viewers. And the first question I'm having in mind when I saw the reports about it is, why did you decide to do it?
Good afternoon, and thank you very much for having me. We decided to conduct this study in order to understand the differential impacts of COVID-19, in this case looking at hospitalization rates and death rates.
Okay.
So this is a,
Yeah, sorry, you're saying this is a?
Descriptive epidemiological study that used surveillance data. It specifically used DATCOV, which is a hospital-based surveillance system that was endorsed by the South African government in July 2020. And it looks at issues of admissions and related health outcomes, the epidemiology of COVID-19 among hospitalized patients.
Okay, so you wanted to have some data, scientifical, to say exactly what is happening, particularly because I'm sure we are always here, and we've been reporting about it as well, that COVID-19 has exacerbated inequalities, has further exposed inequalities. Can we just unpack it, if you don't mind, in the following way? Let's look at hospitalization first. You said you looked at hospitalization. Was there, for example, in terms of demographics, was there particular interesting findings around age groups, around gender, around race that emerge more likely to be admitted for severe COVID symptoms? What did you find?
Yeah, we found differential impacts by sociodemographics. Looking at 215,000 persons who represented a hospitalization rate of 36 per 10,000 people during the period under investigation, which was March 2020 to January 2021. We used population estimates to standardize the hospital admissions, by race and sex and age. And what we found was that Black Africans had significantly higher rates of hospitalization than other racial groups. And we also found that Black African females had significantly higher or highest rate at 16% of hospitalization at the age of 30 to 39 compared to 12.9% colored, 12% Indian, 7.7% white females. So overall, Black Africans had significantly higher rate of hospitalization at a much younger age compared to other racial groups. And the median age for hospitalization, for example, for Black Africans was 52 years compared to the median age of 63 for whites.
So what would mean in simple terms that white South Africans will tend to be the older ones that will be hospitalized in terms of age at 60-something as an average age, while Black South Africans, the age drops to be in the 50s. So this picture that
Can I clarify? Even earlier, because here, in terms of Black African females, we're talking about the age band 20 to 29 years, where you've got like 8.7% African females who are hospitalized. And at the age of 30 to 39, Black African females, we have 16%, whereas, as expected, admissions will increase with increasing age. So there's no abnormality in the fact that as people age, we see more admissions. But what very interesting is the fact that among Black African females and Blacks in general, at a much earlier age, below 50 years of age, were admitted in higher rates.
So how do we, when you do this, you got the data now, then there's interpretation, and sometimes some research come up with recommendations. What are the key learnings here? I mean, very briefly, because we don't have a lot of time, Prof. I mean, I would have liked to spend more time and delve into the other details. But from what you've just said, I mean, firstly, it's confirming that I guess the levels of inequality are highest among those who are most vulnerable, especially young Black women, as an example.
Yes, yes. Indeed. We hypothesize that the existing socioeconomic inequalities play a significant role, in shaping the COVID-19 impacts in terms of hospitalization as well as death rates. And for various reasons that we are well aware of, the structural inequalities that exist. And some South African, and I would say disadvantaged, marginalized, low socioeconomic groups tend to be more exposed to situations that make them vulnerable, especially in terms of living and working conditions. And this range from living in overcrowded households, having unsafe hygienic practices due to irregular water supply, nutrition issues, and structural issues such as difficulties in accessing health facilities, cultural roles for women who have to play various traditional roles, caring roles that often make them vulnerable. And in terms of working conditions, it has to do with things like women being frontliners, always being exposed, and most of them being heads of families. And as a result, being forced to take public transportation to get to work, being forced because they are in informal work to go to work because they wouldn't have leave.
Yeah, lots of challenges there that are being confirmed by your study. Thank you very much, Prof, for your time this afternoon and just unpacking little bit, giving us little insights into this study. That was Professor Refilwe Nancy Phaswana-Mafuya, a professor of epidemiology and public health at the University of Johannesburg.